Singapore has been liberated in a way because no more trace together. So, when was your last trace together logging in?
I think it was just at the malls, when you go get dinner. And I think that was the last one. I actually didn't remember. What it just greeted me on Tuesday. That, everything, all the hoardings are gone. You can go into the hawker centers anywhere. You don't have to go through one single point of entry. So it's good, no? But pity lah, all the new turnstile traced together now it's all of no use.
Obsolete.
Yeah. So all the equipment, the investment that malls, companies, it's all gone lah. I think also people lost a lot of jobs lah. All the part timers who used to do the temperature or the screening and the safe distancing ambassadors, they're out of job now. So good and bad lah, I think, but more good lah.
So, when was yours? Where was yours?
At my workplace, I was ready with my token, and they go like, "Oh, no more!" Like, "Oh, when?" Because it has become part of my daily lifestyle. Like, you need to bring the token everywhere. You stand everywhere. So when I was like, "Don't have, why?" So I questioned it. Oh, lift it up. When? You work here, you don't know, Sam. Because it's like wearing a watch. It's like wearing a shoe.
I guess it's
you need to have
become a sort of habit.
Yes.
After 2 years of having to log in, and it's the fear of getting COVID and spreading it to your loved ones who are vulnerable. So it has become a habit that suddenly it's no longer there.
How time flies. 2 years.
Yeah, I remember those first week when nothing seems to move. You can't go to work. You can't move. I was there standing at the car park, go like, work, come to me. So, but I do enjoy that peace and quiet period. It's hard to see nothing moves in Singapore. We are like a city that never sleeps somehow in the daytime. But now there's jam everywhere. It's crowded everywhere. Buses, trains, and cabs are hard to find. So I was like crazy.
It's like COVID didn't happen.
Almost. The only difference is pre-COVID and post-COVID, prices got higher.
No, but we are quick to forget. So I think it'd be quite interesting to know that we tried so many. I mean, like other countries, we tried so many means and measures to keep track, to prevent, to help manage the situation. But were they really effective? Did anything work? Did anything not work? I mean, were they so silly? I remember when they first started contact tracing. I think it was a legacy from the SARS.
2003.
Yeah, and then they had temperature. The key things from SARS was temperature taking and contact tracing. Everyone had to fill up the form, write down where they came from, did they travel overseas. So I mean, it was laborious, and I know the government had to activate a lot of civil servants, even the army, to contact trace. Was it effective?
But at the start, contact tracing at travel points, the airport, the train, the ferry points, everyone's using the same pen.
Yeah.
It's a spread, think about it. And also using SARS, because SARS was the prevention of SARS was a success. And in order to stop COVID from spreading without knowing what it was at first, I guess we had to look back on previous experiences where there was an international or global pandemic, and that was SARS. But SARS, it started off with a fever, not COVID.
Yeah.
And at the same time, when Hong Kong was trying to prevent the spread and everyone was wearing masks, Singapore
They laughed at them.
Yes.
Yeah.
Didn't even wear masks because WHO says there's no need to. And after a couple of weeks, WHO reneged and say, "Oh, we must wear masks." What gives? Maybe we should take a look back, take a step back and see how Singapore had come so far. At first, we adopt the measures of SARS. Then, after which, when cases were growing, we decide to do circuit breaker.
Yeah.
But do you think circuit breaker helped, or do you think circuit breaker actually was merely a stopgap?
I think we look even one step back before circuit breaker. A lot of the measures were just comforting for the sake of doing. Temperature taking. How effective was temperature taking? Was there any one stopped? Was there any outcome from the temperature taking? It was just a thing that we did to feel safer. So that questions, what was the purpose? And I remember at the start there was a lot of, let's find a better way to contact trace. Bluetooth pinging, NFC, there's so many things that came up, that can help. And I think that's where it slowly morphed into the Trace Together app that we have now.
And the token.
And the token. And the token was because seniors didn't have phones. I remember a lot of programs that we used to run, and it was just so laborious to run programs at the start, because like we need to check temperature, we need to make sure you register, the numbers must be controlled, and then you had safe distancing, or was it social distancing, and that is something that was brought from historical. I think that when the first pandemic happened in Europe, they had social distancing, and then the word changed because we shouldn't social distance, it is a safe distancing. So how did that all really work? And then there was a lot of research. If you run behind someone, the spray, there's so many
Possibilities.
there's
I'm not certain if the government was certain on the things that they propose, because most of it are done on macro level, just to appease us that some things can be done. They put all these measures in place, your temperature taking, to make sure that the entry points are being registered, social distancing or safe distancing. Then we bought the crowded buses. At minute level, it was not taken care of, right? Then trains are so jam-packed. But then again, when you look at that, then you see how biased the measures are at place of worship, where you have to sit all in between distances, right? But then you return home, you bought the bus. It's like, how is that even possible, right? So there's a lot of discrepancies. I am not certain if they really understand the term social distancing or safe distancing. Why prejudice against some and not the rest one? And does tracing really work? What will happen to all those people that have been traced down? Because at one point your token can trace up to 1,000 connections per day. Did they really call 1,000 people per person who travel almost around Singapore to be the super spreader?
I think they did. I think that's how they and I missed the updates where they track patient 001, 002, and they had a whole long list, thousands of people who caught COVID.
I seem to remember,
It's like
I don't
those-
know which organization, but they actually had a huge spider web, and you can actually look at who gave who what.
Yeah, so there was
at
a lot of
which,
effort.
yeah.
So I think that was the in thing to keep track. Or patient this spread to 10 people. Who was the super spreader? So I think that was the whole gist of it at the start of the pandemic. And it became so big that they just stopped tracing really.
See, that's what I meant. Is it really effective?
I mean, we
Because
didn't
they
have,
stop
yeah.
only at the first layer, then done. No more second, third layers after that.
I mean, there's no other way lah. I mean, that was the best they could do then.
Yeah, but
Yeah.
Because they were looking at the Delta variant. in India, where it was like so many, and you don't know who gave what to whom, that in Singapore, you couldn't as well, because really you don't know who gave what to whom. So at the end of it, they stopped. They stopped the spider webbing.
I mean, so ultimately it boils down to decisions made. Do we want to go zero COVID, numbers as low as possible, or do we want to be, if I'm not wrong, like Sweden, go for herd immunity? So I think that there are many schools of thought. I mean, at no point, looking back and say, hey, should it have not been done? I think the world has evolved. The world is opening up now. Only left China who is going for the zero COVID
Which is an
policy.
impossible task.
It's impossible.
Somebody will get infected. That is for certain. In any virus also, somebody will get infected. How you treat it, one. And I think when there was an announcement saying that the best immunity is when your body produces their own antibodies for it. So which means you have to contract COVID in order for you to get the best immunity.
Hence, the vaccination,
Does it work? Why the need for vaccination?
so that you don't get it as seriously as when you are not vaccinated.
Seriously? But how do the people who actually fought COVID-19 before the vaccine was introduced?
They were in ICU, death was high.
Yeah, but then again, there are still people in ICU. There are still people who get infected.
But the numbers are not as high as when it first started.
because they do not know what to do. They do not know how to disassociate the sick and the none. Though they can't differentiate the super spreaders. But at the end of the day, you need to contract COVID-19 for you to produce that antibody to fight it. Vaccines are temporary.
But the
Because it
vaccine
has
does elicit the response lah. And I think from the studies,
But then again, how would you know you have not contracted COVID?
no, they test for the antibodies. You know?
Okay.
Yeah, so it's a safe way of contracting by introducing an inert virus lah. Yeah. So, but then again, there's another measures that was introduced, vaccines that were not fully tested, vaccines that were rushed. You have the mRNA vaccines and versus the traditional inert virus kind of vaccines. I mean, how effective they are, we do not know. Long-term implications, we do not know. I think the whole world, including Singapore, was just wait and see who tests first, outcomes, and we will only know the impact in the years to come. I mean, in the beginning, we had logistical issues. Everybody was trying to ship masks. There wasn't enough masks. The question was, can you reuse? Was N95? I mean, do you remember the days where everything was about masks? And then, we don't not enough masks. We not enough hand
And then
sanitizers.
the masks, there were the reusable masks where people sew their own masks. Whether those are actually effective,
Yeah.
we don't know.
Yeah. I mean, there were so many, and those were the days. And now we don't have to wear masks. So
No,
I'm very, very happy.
correction. You still do have to wear masks at certain events
Correct
and
lah.
activities.
But it's refreshing, lah.
But for me, it's just an automatic thing. You just need to bring your mask anywhere you go, even outside, just in case. It's like even though you don't need it, we are so used already to it. We should just leave it as an option. Whether you can wear mask or you don't wear mask is really up to you.
Yeah,
That-
like a friend says, she feels a bit naked not wearing her mask.
But I think also the biggest issue I saw with the whole measures that were for COVID was, I think also safety. You see a lot of malls had to control one point of entry, one point of exit. And very often they forgot about people with disabilities, people with prams, wheelchairs, and it's very, very difficult to move in and out. I mean, thank God we didn't have any, let's say, fire or evacuation, because the thought process was just prevent, safety and all. So I think that's something that we need to relook in the future. And I think the home ground is also looking at building designs. How can we future proof or future design our homes, our environment, to help with the pandemic. So I think there's a lot of things that we need to relook. And I think 2 years has really taught us, government agencies, international organizations, hey, how can we better treat, and I think on the recent TED talk, Bill Gates was saying, hey, there is a way we can prepare, and the key is actually in the healthcare sector. Have better trained teams who specialize in spotting, immediately getting there, finding the cause and neutralizing the pandemic or the initial virus spread. So I think that's something that Singapore also will need to look at.
I think Singapore also need to look at overcrowding a small city. I think that will be one of those main reason why super spreaders come about. You put a lot of people all crammed together, then it's easy to get infected. Um, Looking at the big picture, should we not be so congested? Should we have a little bit more space outside in the public? Should we have a reasonable number of people meant for trains, meant for buses? So you have that distancing all taken place automatically. It's like when you have space, you would really want not to come so near, right? So overcrowding would be an issue with the virus if any virus in prospect were to visit us again, right? Should they look into all this before they say, oh, we need to go for 6, 8, 10 million for a small city? Can we cope if, let's say, we are a city of 8 million, and which is meant for 5, another virus steps in? Are we ready? Because is the overcrowding, is the distance that we need to take that we can't because it's too small a space to move.
I think that's where we can't run away. Singapore is growing 6, 7, 8, 9, 10 million people. So I think that's where the design comes in, prevention, intervention from the medical teams. But I think something that's missing is the social management. At the start of the pandemic, there was an issue where I'm not too sure who, whether it's the government or some authority, said, hey, if you see someone not wearing your mask, not wearing, inform us. And that had a lot of repercussions because people like calling, taking video, and saying, hey, you're not. And I think that caused a social divide. And we saw people fighting, people being racist, targeting foreign. I mean, there was a lot of issues. And I think that is something that we shouldn't revisit, like calling out someone not wearing masks and stuff like that. Developing that social consciousness, civic mindedness, that, hey, you should just wear your mask, or
You should mind
your-
yourself.
yeah.
Yeah. Be responsible. If you are not well, just wear a mask, like the Japanese do. Or if it's like if you see someone who is not well and obviously a bit concerned, offer a mask.
Yeah, but this thing happens because there is somehow an innate fear or the installation of fear that you get infected. Yeah, you come too close, you don't wear, I wear, but nobody knows how do we really get infected, whether you wear mask or you don't wear mask. If I put an example, the officer that takes care of the gate for our safe entry, taking down notes, do they share the same seat? Do they share the same pen? Do they share the same stuff, same computer? That's not a point for the virus to spread. All these are the minute details, right? But because of the fear, so I think the government also needs to understand that there's a big responsibility to not instill so much fear, or to instill fear. It's like you need to do this in order you to get better. Oh, if you don't do this, you get infected. It's not what you say, it's how you say it. It's how you deliver to the masses. If not, people will panic.
And I think just to add on, I think the greatest issue was actually vaccinated and non-vaccinated. You know, I mean, towards the end, we started to see a lot more measures that says, hey, you are Singaporean, but just because you're not vaccinated, you can't go out, you can't go here, you can't go there. I really don't. I didn't like it, and I don't. And I mean, if we have another pandemic, we shouldn't do that. You know, so I think it's an issue. You know, I know the unvaccinated had a higher chance of getting the virus and straining the healthcare system.
But there are two groups of unvaccinated. One is because they couldn't,
Yeah.
they have health issues. Then there is that group who choose not to be vaccinated. So, for whatever reasons they choose not to be vaccinated, all and good. But you do have to understand that there is still that fear of, if I were to give you, who is not vaccinated, the disease, you might die. And I don't think I can carry that guilt with me,
Mm.
you know? So, once again, it's, yeah, I respect your choice, but I don't want to have that guilt put on me if you were to be ill because I was.
True.
So do we really have an option to get vaccinated or not?
Yes.
Really? Because it seems that everything is moving towards say you are not vaccinated, then you can't go out, you can't visit.
But now there's no point of entry where you have
Yeah.
to say I'm vaccinated to come in.
So it's okay not to be unvaccinated now that we can all mingle happily.
You would know, right?
So, let's say three of us now, we are ministers, and now we are MTF 2.0. You know, so let's say if we have another pandemic,
Mm.
tell me what will you all do? It will be the same, or what you will not do. Ladies first.
Oh no.
Okay. With the experience of this COVID, I think hospitals, the healthcare professionals would know what and what not to do. And I think that the immediate thing would be stop the electives, ensure that people who are sick with the pandemic are taken care of, people who really need to be attended to, like people who are going for cancer treatments, would be attended to. And as an MTF minister, I think I would sort of like divide which hospitals to tend to the people who need it and which hospitals are designated for the pandemic.
Think preventive measures first. We need to provide the first round of medication to all the local family clinics first. Get advice first whether how to prevent it at your best. At your best, if you get, then there'll be temporary hospitals, not at the normal designated hospital. Temporary hospitals to be built up, just like how they build the army hospitals from time to time. Build it up just to serve those who get infected by it, if they can't contain it. But I think isolation is important. It falls back even during 1,000 years ago in the Middle East. Once you have a pandemic, you need to do self-isolation. So I think from now until the prospective virus that might step in, we need to educate public. You need to be responsible. If you have something that will spread to others, you need to do self-isolation. Now, that would be the first step of measure that we need to do. Then, if you get infected, we have dedicated team, which means we need to expand our healthcare system or the healthcare industry to make sure that these people are taken care of at their special areas done. Isolation would be the key, and we need to educate public on how to do it correctly, which is almost done correctly now, but it's still not properly tracked they're like, what is the right SOP if you have isolation? Whether you go to the hospital, in a room used to be one person to each room, now you can share with another person that you don't even know. So how do you do that properly? We need that proper SOP, so even someone who as young as 10, 12, 15 understood, if I get this is what needs to be done, like that. I think public education must start from now if it happens again. What about the chief minister?
Oh, I'm coordinating the
No, no, no,
co-chair.
no.
No, no. No, I think definitely we will never be able to say that it is unprecedented. No, nothing can beat. I hope not what we went through. So I think definitely what you highlighted from education is the key. I think it's just like how Japan prepared for an earthquake. All the kids are trained. Education is key. And I think decentralized approach, pop up isolation, pop up medical centers, and equipment. I think we don't want to be the experience of India where they didn't have enough oxygen, breathing apparatus. I think that was quite sad to see. Um, the thing I would do different is I wouldn't close the economy. I think the circuit breaker did a lot of harm. Although we did spend money, we all isolated at home. I wouldn't want to revisit that from an economic point of view. I don't think we can afford it anymore, and it was very disruptive. So I think that's the difference I would have made. But like what you said, education is key. Preparedness is the key thing. Do we close our borders? I think we might have to. I wouldn't change that. But I think a lot more self-sufficiency is needed from food production. I think the Singapore post-COVID is very different. In prior to COVID was everything outsourced. We don't need to be based in Singapore, from farming, from food. I think it's a radical change, and I think we need to be very independent. We talk about the 5 pillars of defense. Your military, economic, psychological, whatever. And I think being self-sufficient is key also. We saw a lot of issues, countries hoarding vaccines, countries hoarding food supplies,
Toilet paper.
toilet paper. Yeah, so I think as an MTF, we need to prepare, have all this ready. We really struggle. The government, Singaporeans, really just learned along the way. But I think we can be better prepared for 2.0. Yeah.
You see, but if you have a whole lot of supplies like vaccines, like food, you have to constantly check on expiration dates, because there are some people who would hoard and not check. Or let's say the government would have a storage and not check. And if you were to need that supply, suddenly it's expired.
Yeah.
So I think we also have to learn how to check if your stock has expired, or whether you need to restock during good times, rather than just hoard and hoard and hoard, and then when you really need it, you see that canned sardine had expired, or that vaccine that you so needed for, say, even for flu, have expired.
I think you hit it right there. Singaporeans were never prepared for a crisis. You always have a crisis bag. For what in the past, I think recently was about terrorism or something like that. But I think we need to have that crisis mentality that, hey, something can happen, I need to be prepared. And I think that would make us a lot more resilient, and be prepared.
Like the Japanese during it's like, look, we have these strong rooms in our flats, where should Singapore be bombed, you can stay in that room and then come out sort of unscathed, but no one tells us what to put in that room. You can stay in that room for days. And if, let's say, if you are in Ukraine and you get bombed constantly, you're not going to come out from that room. So, what are you going to live on? No one has taught anybody what to put inside that pack that you need for an emergency. So I guess, Adi, you're right. You have to look at education from a very young age.
And we also need the government to invest in research a lot more to understand this kind of war, right? It is a war for us. We are facing it. Some of us went down with it. Some of us try to cope with it. Some of us are unscathed by it. But the big picture is everybody went down by it, economically down. Nobody knows what to do. We are waiting for the government to hold our hands and guide us through, but they themselves are struggling to understand how to cope with this because different people have different coping mechanisms. The government should be ready to equip us mentally, and like what Kevin said, must also help us on how to prepare for crisis in all sorts of it. If you look into the Japanese community, where we adapt neighborhood police post, the neighborhood police concept, right? It's like this one small community, then there is one policeman where everybody in that village knows who they are and they manage safety. And I think we can adopt that bit where we have, let's say, few blocks of flats, then we have the head of these 3 blocks where they will help us manage on how to do this frequent visits. If this thing happen, then you have to do A, B, C, D. You know why it's easier to speak to people like that? Because they're familiar. Rather than once in a while where there's crisis, then you have messages through the broadcast system where people are just in fear, they cannot even register anything. So it is going to be a slow burn but a sure thing in the long run. So investment, time and money should be placed into that direction. That's what I think.
I'm curious to know. After SARS, we had the fabric of a nation. I wonder what they're going to do up for this pandemic.
Fabric of a nation, where everyone sews the quilting, right? I'm
I
not
wonder
too
what
sure.
they
I
will
guess
come out
we
this year.
guess we have to wait for National Day.
True, but then again, the question would be: did COVID bind us together?
Contact trace and find out the answer.
Yes. Please share the data.
Thank you.